sir? Now is it fine?
Yeah, it is better,
Yes,
madam.
yes.
Yeah. Thank you so much. Yeah, good evening, everyone. Good evening, respected all. Still it is echoing?
No,
No,
madam, you can go ahead.
Okay. So I welcome all of you all on behalf of Indian Association for Medical Educationists on this symposium on model learning strategies. I now invite our very enthusiastic National President, Dr. Pragnesh Parmar, sir. Is sir there for the welcome address, please?
Thank you. So, good evening, everyone. As a president of IAME, it's my honor and privilege to welcome you all the speaker and participants present today. As we know, this is the third event of IAME. Back to back, we are trying to deliver whatever best possible. So today's topic is very important regarding modernization. As we all know, we are medical teachers and related with the medical education. And as the time is evolving, we have to evolve ourselves. And today we have distinguished speakers. So I welcome respected Dr. T.K. Bose sir, Dr. Swapnil sir, Dr. Anuradha madam, and Dr. Trupti madam. So definitely at the end of this session, I am sure we all of will learn a lot of things. So I welcome you all. So let's begin this session. Thank you, everyone.
Thank you, sir. Thank you for the welcome address. Can I now invite our Central Zone Secretary, Dr. Sagar, sir, to address us on this theme of the symposium and also introduce our speakers.
Yeah. Thank you, madam. Thank you, IAME, for bringing this symposiums on a regular monthly basis, which we are missing for a long time. You all know our medical education is not a simple system. Earlier, it is like a book and teaching things going on, and we used to carry many troubles. But now it is different. We have to study and teach in a different angle. And there is a different mechanisms going on, especially like a rapidly evolving field. This is the field where evolution is coming here on a regular basis on very short notice. And we have to be ready to capture that. Complex health systems, healthcare systems, many systems are coming up. We have to cope up with them. Personalized learning needs and interprofessional collaborations, better patient outcomes, and other things are there. Let us hear from the today's speakers. We have 4 speakers with us. First one is Dr. Anuradha Joshi.
Thank you, sir.
Thank you, ma'am. She is a professor of pharmacology, a leading faculty in medical education, IMSR Gujarat, director, founder, Global Creative Academy, and then advisor for creative medical curriculum. Ma'am looks very young, but her degrees and her experience are vast and very entirely different. And very interesting is she is a CMCL FIMER graduate 2016 and ACME fellow 2014. Expert advisor to faculties at SUNY, New York, USA for bringing creativity in medical curriculum. Welcome, madam. Please go ahead. Thank you.
Thank you so much. Thank you. So I'll just share this. Okay. Is my screen visible?
Yes, madam. Yes, it is.
Okay.
Yes.
So full screen is visible or like?
No, madam, you have to put it in slideshow.
Ma'am, make it in the slideshow, please.
Okay.
Yes.
Am I audible?
Yes,
ma'am.
Okay, first of all, thank you to the dignitaries and this association for inviting me for this talk. So today I'll be starting with the what, why, and how of creativity in medical education. In today's session, I would be covering the what, why, how, the challenges, and the way forward for how to bring creativity in the medical curriculum. Now, I was pondering over this, that how should I, because this topic I've been working on this for last 25 years now, And I was just thinking how to assimilate into, how to make it succinct and in front of such an elite audience. So a few things I have bought here. It's just the tip of the iceberg, which you'll be seeing here. But you will have a fair idea what all we are doing at our institution. And regarding the Jacob School of Medicine and Biomedical Sciences, New York, that is at the Buffalo University. Last year only I was invited there, and in fact, I was working on bringing changes in their curriculum for last 2 years. And the name of their curriculum is actually Well Beyond Curriculum. And in that, one of the component is Art of Creativity and bringing creativity in the medical curriculum, which actually refers to the components which are beyond the traditional and textbooks based learning, focuses mainly on transformative education, and focuses on the meaningful methods to prepare the medical students for a future oriented medical career. So I just wanted to brief you about what it is actually all about. That is what I'm doing at US medical schools. So first, starting with the word creative. Now, there are a lot of misconceptions about creativity. Many people think that creativity is just painting, art, and something to do with colors only. Now, actually, the word comes from the Western literature, but it has existed from time immemorial because we all are aware that humans could not have survived without creativity. So this brings us to this, that creativity was and is and will always be a necessary survival skill. And it is creativity and of course critical thinking, collaborative thinking, all that is going to differentiate our whatever pedagogies, andragogies we are doing. That will take it in a different way as compared to the AI. We'll see just now what all activities we are doing. And I have seen that the entire process is definitely interesting and it is out of the box. And many a times, even the AI is not able to do bring in the level of creativity which our students are bringing in during the process of creativity. Now, the word creativity actually comes from Latin, that is creo, which means create. And this appeared in English as early as 14th century in one of the English literary professors, that is Geoffrey that is Chaucer, in the Canterbury Tales. And at that time, creativity was something to do with divine creation only. There was no element of human creation in the create word. While the modern meaning of creativity in reference to human creation emerged after the age of enlightenment or the Renaissance. And yes, creative processes in Indian literature, they have been mentioned way back before all these centuries in the Vedas and the Upanishads. And there's a very good article by Maharaja Raina on character of creativity, the Vedic perspective. Do read about it. So what do the scholars have to say about creativity? Now, the first person to apply this word was a Polish poet, that is Mackenzie, but he applied it only in the concept of poetry. For over a century and a half, this idea of human creativity actually met with resistance. But in the year 1875, the word creativity appeared in print, and it was actually used by Adolphus William. But that time also it was used infrequently and on an ad hoc basis. But from the early 20th century till date, creativity has evolved through a process which has been pioneered by Graham Wallas, who published his work in the book The Arts of Thoughts. And in 1927, the mathematician Alfred North has been credited with having coined the term creativity. And as a result, as we have seen so many creations and innovations since the time immemorial, creativity word became a ubiquitous word in the field of science, arts, and literature. Now, definitions of creativity. most of the creativity researchers, in fact, all of the creative researchers and scholars, anyone who is interested in creativity is always struggling with the exact definition of creativity. Now, some of the definitions I've brought here because I'm honoring the time. There are zillions of definitions on creativity, but some of them which I've listed here are very pertinent and important. That's by Guilford. Creativity should have originality, novelty, and a divergence element. Arthur Cropley says that creative things should be worthwhile and should reflect some compelling property. Torrance said that it has the capacity to detect the gaps, the lacunas, and propose solutions to those problems, and then in turn build some novel ideas to help solve those problems. Runco states that creativity should display novelty, relevance, originality, and effectiveness. While Dean Keith Simonton, he defines creativity as it should be useful, it should have some level of surprise, and there should be a probability of an idea. Ultimately, figuring out to originality, useful, and there has to be some surprise element in it. Now, to make definitions really meaningful, one has to look at them as various analogies, like creativity is like wanting to know, digging deeper, having a deeper approach, looking twice to a particular thing, crossing out the mistakes, not being judgmental, getting immersed. It can be a daydreaming or something because it starts with a chaos actually, and then it proceeds to become a process, and then we give value to it. And yes, singing in your own key, like shaking hands with tomorrow, that's very important. Coming on to the next aspect of my talk, why? Why we are talking, why we have assembled today, why this cohort who's so much interested in creativity. We all are aware that change is the only constant thing in life, and sooner we embrace it, the quicker we discover the world's beauty and opportunities it offers. And the way students learn is changing, so the way we teach them has to change too. So thus, in the educational settings, creativity is seen as a special approach to learning that involves creative teaching as well as creative learning strategies to facilitate learning. And how it helps in the medical classrooms, it fosters creativity, has a lot of the students, it caters to a lot of curiosity, critical thinking, inquisitiveness, and yes, an element of risk-taking is there. And world is changing at a faster pace than ever before. Students will need to continuously deal with new and unusual tasks and the situations. So again, if we go on to the really objective part, that if we see that what is why do we need creativity in the medical classrooms? To delete this concept of rote learning, to delete the academic monotonies, reading subject mindfully, reshaping the attitude towards content, looking it in a different way, inculcating a moderate degree of curiosity, promoting deep learning, reflective thinking, collaboration, and obviously group dynamics and significant learning environments. Now, according to Kaufman and Begetto, they say that they talk about the 4 C's, about the communication, collab, critical thinking, and creativity. And they even talk about the model of big C and the little c. The little c is the C which we usually see in our generic lives, in our generic classrooms, in the students who are creative. And as they progress, as the teacher or the mentor identifies that the students are creative and gifted, they accelerate to a stage of big C creativity. So it's easier said than done that, we should bring creativity. But among the many challenges we teachers are facing today, how to keep the entire classroom process, sessions captivating, interesting. So let's see the how. So I remember way back in the year 1998, when I joined the pharmacology department, I had a keen interest in teaching. My only love, passion was teaching, be it any subject. Of course, Physiology was my first love. And then, of course, pharmacology I got by chance. But my only objective in the class was make the students understand whatever I'm teaching, but in an interesting way, rather than a stereotype way. So it always used to start with a chaos. And yes, then I started publishing my work and then giving value to it. It became, and then I started presenting internationally and nationally. And now I'm doing a lot of researches in creativity in medical field. So dear friends, with this brief introduction about the what and why of creativity, I welcome you all to this land of incredible and vibrant process. So tools of creative medical education, actually, there are many. It's like, it's an ocean actually. Some of them I have listed here, but today, because again, I'm saying I'll be honoring time, so I'll just be talking about the first 4 or 5. Now, all these can be converted even into digital tools as well, right? Now, first we go on to the autobiography or personification concept. Now here, the inanimate objects, like in pharmacology to the drugs, we are giving a life to the drugs. Like for example, you can see here that from sore throat to heart infection, I kill any bacteria that comes in my way. I am a beta-lactam superior to ampicillin, combined with clavulanic acid, ferocious IB, and my name is amoxicillin. This is my story. So teaching amoxicillin just in a stereotypical way and teaching amoxicillin just bringing one prop, one slide like this definitely brings some attention in the mind of the students, and they find the entire process interesting. So students have been asked to prepare, narrate autobiographies. Now, autobiography concept, I remember when I presented in US, one of the colleague there, one of the presenters, in fact, told me that, Anuradha, it is better to use the word personification rather than using autobiography. So now whatever papers we are writing on, on giving this figurative language to the inanimate objects or the medicines or anything like, in public health official, recently they did about the Ganges, the arsenic poisoning, the Bhopal gas tragedy. So we are using this word personification. So this particular poster, I remember, was selected in Association of Medical Education Europe in 2013. I presented it there. It was well received. And all these papers which you will see here, they are all focused on how we can use personification or autobiography in pharmacology. And in the book of Humanities in Medical Education, which has been edited by Dr. Rajiv and respected Dr. Tejendra Singh sir, there's a chapter on creative writing, personification, and autobiography in this particular book also. And these are the various papers. And the last one which you see here is in pipeline. That is now the creativity concept of creative writing, that is personification, has been taken up by the public health department in our institution. And we have written a short communication for the same. Next is educational gamification. Now, this is one paper which was awarded in the Southeast Asian conference, and there the jury was Professor Kevin Eva. Now, cardiovascular drug cricket was a game which we played for antihypertensive drugs. You will, once you read the paper, you'll appreciate that they were the teams of the batsmen and the bowlers. The batsman coming with the bat of hypertension with CCF, and the bowler has to throw an ACE inhibitor. In case if a hypertension with asthma is there, and if the bowler is throwing a beta blocker, then definitely it's a no for the bowler's team. So we played the entire game in the classroom. I have the videos of it as well. And the entire thing was conceived, that is way back in 2010. It took me 2 years actually to start this project and get an HREC permission and do this project. And yes, we had a lot of success with this particular activity. We initially started with this creative posters, and then we went on to playing cricket in the classroom. And then I presented this paper in ceremony, which got the first prize. And I still remember respected Dr. Rita Sood ma'am, who awarded me the prize for this paper. So what actually we saw in this paper was that there was no statistically significant difference in performance of pre and post test scores, but majority of the students enjoyed the new learning process. They found it engaging, interesting. So it's actually creativity is mainly focusing at the process, right? So this is something which I have taken it forward at Parul Institute, wherein I conducted this activity again in the students. Of course, we had less attendance that time, but yes, the entire faculty was there and they wanted to see how cardiovascular cricket is played in the classroom. And we did that in Parul Institute as well. So these are certain papers on educational gamification, which you can appreciate. And again, there are a lot of papers on educational gamification. Now, recently I came across a paper of analog games. Now, analog games are something which have got that, their interactivity is there. So even this educational gamification, if we are playing something like this, cricket or a board game or snakes and ladder or crossword puzzle, all this come under the ambit of analog games, right? So this is about the cardiovascular cricket. And the third one is creative study guide posters. Now, this was an activity which I undertook for explaining the concepts of antimicrobials when I was taking general chemotherapy for the second MBBS students. And there what we did that we after teaching the entire lectures of all the medicines, all the drugs, we had a revision slot wherein we had two teams of the Kauravas and the Pandavas. The Pandavas were actually depicting the antimicrobials, the good ones, and the Pandavas were actually representing all the germs, right? So the poster was made by the students, and this is how it was represented. In fact, my idea was to play this in the classroom, but when I approached the HREC, they said that if we take bows and arrows, it can be a problem in the classroom. So we had to, just think about some other alternative. But then we thought of making a creative study guide poster that this is the way I actually wanted the entire scene in the classroom. Next is again creative study posters. We have recently done thalidomide memorial activity wherein we have created an entire thalidomide memorial with 8 stations in the foyer of the medical school, and wherein the students had made a lot of posters on drug alerts, teratogen, clinical trials, and a lot of collages they had made. So all this comes under the creative study posters. So this is the article. Now this paper is cited in this article, Learning by Making. This is one in the BMC. Recently, I got this notification that my paper has been cited in this particular article. And I'm so happy and thrilled to see my paper there. And really, and you just read this paper also, Learning by Making. It's a beautiful paper. And these are some of the works which we have done in Creative Study Guide posters. And second last is Cinemed education. Cinemed education is a concept on which we have been working. I've been working in collaboration with Malaysian teachers, Malaysian educators, especially Dr. Ravi Shankar and Dr. Munir Babar. And this concept we are bringing in our institution. You can see this banner. This has been created originally by the student. We conducted an activity on Cinemed education, and you can see this poster has been created. It's a Parul University production directed by cast, and all this depicted in this one poster. And I remember in the year 2009, along with some of the students, we prepared a thalidomide audiovisual. And that was taken up by the Indian Pharmacopoeia Commission by respected Dr. Vivekanandan Kelai Silvan sir. And in their set induction, they usually show that audiovisual to the participants there. And I just want to just show you here just a glimpse of a creativity. I know we don't have much time, but just maybe for 2 minutes, we can just 1 minute we can see. I'll cut it in between. We still need to refine this, but this was actually compiled and prepared under my guidance by the students. So I'll just not go into the detail because this is what we did. And next, we even are showing the movies to the students, the Gifted Hands for the first years, and then the Doctor movie 1991 we've shown. And the third one, which we are going to show, it is maybe on Ankur Arora murder case or something which is related to the medical students, any series, any clips from that, right? So as you can see, we are doing a lot of activities at PIMSR. We have got a lot of autonomy there, and the management is all for such student-centric activities. And till date, in pharmacology, as well as in the first year students, we are doing the CineMed activities. So these are some articles on the CineMed education. One of the chapter has been published in the book Humanities in Med Education. And then other things, a tribute to thalidomide victims that was published by the Indian Pharmacopoeia Commission itself. You can see it on the YouTube. It's published under my name. And yes, along with the respected Ravi Shankar sir and Kalra ma'am, and along with others, we are doing a lot of activities for taking CineMed education forward. And the last is using poetry in medical education. Again, we know that poetry instills an element of empathy in the student, reasoning, reflective thinking in the students. And I'm very thankful to Swapnil sir for helping me in this article. And there's another one which I wrote, a letter to Rabbit COVID at the time and during the time of COVID. What are you up to, Corona? And I'm again thankful to respected Upri Dhaliwal ma'am for taking keen interest in this particular, this piece of creation. And she, did some modifications. She really wanted this paper to come up in the rhyme, right? So now there are other activities, but again, because of the time, I would not like to take much time. Bead and art experience, emergency tray preparations, which are again fostering critical thinking. They are promoting a lot of reasoning skills in the students. Then GIT revision clay modeling. This is the one which I've already presented in Finland. And this batch, 2013 thing, I don't remember this batch, 2013 batch, the students were really bright and we did a lot of activities. And these are some of the clay models which I got from the CMCL Ludhiana from respected Dr. Dinesh Bhatia. So now if we see what do the students have to say about all these creative endeavors, they liked it. They, as you can see here, good experience, last minute revisions, de-stressor in learning, helpful. But what are some of the challenges? It's very time taking, self-directed readiness hona chahiye students mein, tedious hota hai. Preparation is, the amount of preparation needed by the teacher is enormous. And it really, the teacher has to prepare the blueprints and everything, discuss with the entire department because it's all small group presentations, discussions, and then the entire department has to take part. So yes, friends, was this all easy? Because whenever we do such things, everyone asks, where is the proof? Where is the evidence? We know that the students are happy. We know you are also satisfied, but what next? Where is the measurement? So this led me to start publishing my work, and each and everything which I did, I started publishing. And I started presenting it in various states of India. In US, I presented in Helsinki, Singapore, Mauritius, Finland, Sri Lanka, Malaysia, and Prague. And everywhere, even Dr. Ronald Harden, once he was there, I visited Prague, and that time Dr. Ronald Harden sir was a witness to this autobiography of drug paper, and he appreciated that work. So yes, there have been a lot of challenges, and for any institution, researchers have described aspects of organization that can facilitate this innovative behavior. One should have the freedom to make decisions. There has to be support from colleagues with whom one directly works. There has to be a facilitating attitude and a leadership style of the superiors. And yes, command and control structures just don't work always. In fact, not when you need to do creativity in the medical classrooms. You need to have a very cordial environment to bring in creativity in your medical lectures and sessions. And yes, along with this, one of my biggest cheerleaders have been my CMC famer friends. There's some sound coming. My CMCL 2016 batch friends. And when I was received the award, that was an impetus for me that whatever work I'm doing, that is really taken well. And I'm really thankful to Dr. Tejinder Singh sir and Dr. Dinesh Badial, Dr. Rajiv Mahajan for always encouraging such types of works. And as you can see here that these are my cheerleaders. They are my real well-wishers, my entire batch of 2016 who have always been such a great motivator for me. And yes, there's something which Thomas Levitt he says that why the organizations that many organizations they tend to only stress on one aspect, that is novelty, but they fail to invest time and resources in the second half, that is usefulness and the implementation aspect. So I have yet to see that how the novelty, originality, creativity turns into something innovative, because innovation is the last step of the creativity. And yes, what next? So are the lectures dead? No, not at all. We need to bring fuse elements of creative teaching along with adhering to the particular formats. Motivate and encourage students, encourage them to fall in love with someone, encourage them to be passionate, recognize their talents, and yes, mini reward should be there, because there's a lot of theories on rewarding the students regarding with the dopamine theories. So we need to give them rewards, but in a very balanced way for creativity. And yes, there have to be models of pedagogical management, including creative pedagogy in a lesson. And that's what I'm getting an opportunity at PAMSR. Lesson plans are there. Lessons we are taking out according to CBME. Jahan bhi there is a free slot. I keep a track. I keep talking to all the academic review people. I keep in touch with them. Wherever I get some slots, I start planning the next activity for them, right? So we can do that. And yes, flipped classroom is the need of the hour. We need to bring in flipped classrooms in medical system, right? And I would like to thank Swapnil sir for this initiation. Lastly, I would like to acknowledge my parents, my family, my husband, who has always been supportive for such activities, my kids, who have been always, a big cheerleader for me, and my gurus, especially Dr. S.K. Singh, the late professor in pharmacology, Dr. Andre Alakunovi, the most creative man in this world, Dr. Tejinder Singh, Dr. Dinesh Badial, Dr. Teresa Amabili, who I got a chance to meet in US, Dr. Dean Sementon, again, who I got a chance to meet him in US, and my well-wishers and medical students. So I'm really thankful to everyone. And I would like to share here that I have published a book by the name of Just You and Me, which again depicts some of these activities. But yes, since 2013, there are a lot more in in that creative toolkit. So I need to start working on another book now. So I would like to thank everyone for patient listening, and thank you so much for inviting me. It's an absolute honor for me, and the work which I've been doing, I got a chance to present in front of everyone. Thank you so much. And this is the Global Creative Academy, which you saw in the bio in the starting. So out of my FAMA project, which I did on the assessment of effective learning strategies, now when I am into an entrepreneurial field, that is Global Creative Academy, wherein I take, I counsel students, I help them in their learning strategies, and I even conduct workshops for teachers to bring in creativity in schools and in the medical colleges. Thank you so much.
Thank you, ma'am. That was indeed an absolute honor to listen to you.
Thank you
I
so
know
much.
everyone will agree to this, that what an interesting way to instill this creative thinking, reflective thinking among students. I'm sure, madam, your classes would be packed.
No, but it's just passion for teaching, and I mean, every educator, I'm sure, loves their students and loves to see those smiles and the sparks in their eyes, and that is what is something which every educator wishes, right?
But what perspective, ma'am? Autobiography of drugs, educational gamifications, creative study, posters. I
Yeah.
mean, it was totally wonderful. It was totally an honor to listen to
Thank you so much. Thank you so much.
Thank you, ma'am. Thank you.
Thank you so much. Thank you.
Can I request Dr. Sagar, sir, to introduce our next speaker? Dr. Sagar? Dr. Sagar, sir, are you there? Okay, no worries. I'll be inviting Dr. Tapan Kumar Bose, sir. He is a retired medical legal expert and academician. He was a former professor in forensic medicine. Sir will be talking on collaborative learning in medical education.
Thank
All
you very
over to
much.
you, Dr. Bose, sir.
Little correction, I am not Topun, I am Taposh, DFPIS. That is
Oh,
not a
oh.
problem. So I am thankful and to Madam Anuradha for her excellent talk, and we are all birds of the same feather, and we want to implicate it in different ways. Unfortunately, it depends on the institution to institution, the facility and others. Anyway, my topic is collaborative learning is in medical education. Where my screen is visible? Are my screen
Yes, sir, it
visible?
is.
Yes, sir.
Yes,
Yes,
sir.
sir.
Okay, I'm coming to slide. Just 1 second. Okay, so I start with a very famous saying of our Honorable Prime Minister, Sabka Saath, Sabka Vikas. So unless it is collaborative, that means Sabka Saath, then only we can learn, because every time, particularly nowadays where the number of students are 250 in most of the colleges, it is impossible. In our time, it was very small group and we actually teachers interact very excellently. But now it is very really difficult in a time span of 1 hour how to manage them. So that can only be done as it is shown by Anuradha Madam, that we should make our subject interesting. And the fundamental theme is to make the student learn only one thing to be done, that is to make them interested. If they are interested, they will read by themselves. Otherwise, even with 1,000 efforts, it cannot be done. So we are starting this topic. Okay. So why it matters, collaborative learning? It is healthcare teamwork. You know that healthcare is basically a teamwork. It cannot be done by an excellent surgeon or an excellent physician alone. Always help of the other peoples are required. And nowadays, peoples become so much isolated in small area. They become living in a small area of the life and don't want to interact. Earlier, we have seen people are gossiping. Now you see everywhere that people are busy with their smartphone and on WhatsApp or some other thing. They are not interacting. And that is the fundamental problems in everywhere. Number two, the patient outcome. Because always two brain is more than one brain. So whatever I am thinking, if I share it, if a team shares that, new things will come out. And definitely what is not possible for me can be solved by others. And again, it decreases the medical error and the accreditation standard will fall. So the power of collaboration as it started, it shifts from individual learning. We are not pointing to individual. In our time, stand up and ask some question, that is gone. Now it is a team-based approach for increased knowledge retention and critical thinking skill. Improve communication and interpersonal ability, prepare future doctors or doctors for their interpersonal healthcare activity. It has been seen that there is 15 to 20% improvement of the students in academic skill in collaborative setting than exams. So what are the strategy? There are basically 4 strategy. I'm just touching them because time is very limited. One is team-based learning. Before, again, the main burden falls on the peer teacher. He has to prepare it, pre-school preparation, readiness and readiness assurance test, and the application exercise. That what to do, how to do, and when it is to be done. And then problem-based learning. Because human beings are almost always like to solve problems. So when there is a problem, so then nowadays everywhere the university questions are like that. We start with some problem and then come to the solution. Then that is the current scenario. Third one is case-based learning. That is patient case, developing diagnosis and treatment collaboratively with a case history and case analysis. So problem-based learning, team-based learning, interprofessional education. That doesn't mean that now we are not isolated. We are not islands. We are communicated. So it is no such thing as medicine, surgery, obstetrics, pediatrics, etc. All are interrelated. So if we take the help of the different disciplines, it will have a very good thing. And peer teaching, that is already touched by Anuradha madam, that how effective teaching can help developing these things. Now, real world examples are of collaborative learning, sir, interprofessional education, that is collaboration between medicine, nursing, pharmacy, and other health professional students. Again, it is between the same profession of different discipline. And community-based approach. Now, community medicine, particularly, they are having this public health work, adopting family. The students go directly into the family and know their problems and the health issues. So what is the benefit? Number one is communication. When we are together, we can communicate excellently. Otherwise, if we are single, we are depressed, we cannot have anything. It definitely increases motivation. And because we are seeing that somebody is having a better response than me, then I must ask myself, what is my problem? How I can improve? So this competitive attitude will increase the motivation. And definitely it is a collaboration in particularly clinical practice, may be done in all types of medical practice also. So how to implement that? The implement is very difficult, but first it will start with the curriculum design. Because I know in most of the colleges, still they are following that same techniques of class, that is old rotten lecture class, that is spoon feeding method. Somebody will have a lecture and the students may sleep, may do nothing. So we have to design our curriculum into some innovative things so that the learning objective, as it is already emphasized by National Medical Commission, but again, most of the colleges are not following it. They are following the same old topic, but giving the same thing as NMC, that is what are the things to be done. And definitely it will be done by the faculty, and faculty must have been trained. Proper guidance on facilitating group work and assessing collaborating skill will help the faculty to develop. And definitely there is use of technology. Whatever we will do for online platform, for communication, for resource sharing and collaborative process. Now the technology is very important. Nowadays, technology, most of the students means it is AI. They know that ChatGPT or Claude AI, put the question, answer will come and they will know it. But that is totally wrong idea. But there are a lot of newer things in technology, medical education technology. Say, for example, taking feedback, asking online questions, or taking the quiz. All these things can be done with technology, but it requires smartphone is now with every hand, but some logistics on the department or the college. Now, problem-based learning, it is again very interesting, must have small groups, 6 to 10 students. Another problem here is most of us, even our small group discussion consists of 50 students. So how it can be small group and number of faculty is very less. It must be self-directed, that means learning with expert facilitation. Teacher should not tell anything. They will be motivated to tell their things, and then ultimately at the end, the teacher will summarize, and that will lead to skill development, clinical reasoning, and communication. That is in National Medical Commission CBAB program, already given and illustrated, even under the heading of ATCOM or other things, but actually it is not followed in most of the institutions. So how team-based learning can be done? It is a pre-class preparation, individual readiness assessment, because some will be more attentive, some will be less. The teacher must point out that in a group who is inactive and who is how to make him active. You know that all the management school, they are given more emphasis on group discussion, GD. And GD should be a type of assessment so that we can understand the lacunae of the students, the team application exercise, and then, of course, the peer evaluation, which will make a Indian medical graduate the theme. So inter-professional examination is different discipline together. They should have a collaborative practice. They address the stereotype things. Say, for example, the same thing, the anemia or shock, it is in many disciplines. So if we make a joint effort on that, so that students can understand the things better, and at the end of that, the student may present in a small seminar so that they are encouraged to become participant, as well as there may be quiz or group discussion or any other thing to make them encouraged. So breaking down professional silo, focusing on collaborative practice, competency and joint simulations with nursing, pharmacy students also. There is no harm, all are aim is same, that is the help of the patient. So take enhanced collaboration, that is virtual patient quiz. If patients are real patients are not available, virtual devices are available. It is there in most of the e-class or most of the skill lab as per NMC curriculum, the collaborative platform, the tele-check and telemedicine and mobile team app. The how it is effective. The effectiveness comes from enhanced communication, which lead to improved reasoning, then team role, student satisfaction, and clinical preparation. So we have a clinical preparation to enhance communication by this process. Now, what are the challenges? The challenges are, number one, unequal participation, because it is not possible that everyone should be attentive. We shall try to make attentive and try to find out their problems. But as per my experience in a private college, that a lot of the students, they are having no interest in at all in medical discipline. They have been forced by their parents and they have got money, so they have entered. And naturally, it is really difficult to make them interested because they might have some other interest or something like that. And again, time constraint, because there are so many subjects and so less time, and that will be cut with the festivals and other activities. So in the small time, it requires a lot of time. So only by integration, the time problem can be little solved. So faculty must be developed, because otherwise there is no value in it. Now the logistic hurdles that I've already told about, the logistic gadgets as well as the other things in the class, this internet, etc., and the resource requirement. Main resource is human resource, that is the number of faculty. NMC has given such a nice thing, but they have reduced the number of faculty in most of the discipline. Yeah, I can just share my discipline, forensic medicine, where even with 250 students, the strength is 112. That means 4 people will manage 250 with all these things, along with the autopsy and other things. So how it is possible, nobody thinks. So collaborative learning is a vital component of medical training. Proper future doctors for complexity of the modern healthcare through continued innovation, embrace collaboration, encourage innovation, and prepare for the future. So our goal should be to have a good doctor or the GCP, good clinical practice for the futures, so that they will be happy to study and happy to learn. So faculty training, then there should be pilot programs, and then it should be integrated with the curriculum, with the proper pros and cons, that is what is there and what is not there. Perhaps I'm excluding time and I'm finishing. So collaborative learning in medical education leads to enhanced medical knowledge, skill, teamwork, and interactive learning. Prepare future healthcare leaders through collaborative strategy. Nobody has been rewarded for having a brain, but for using it. As Anuradha madam shown us example, you can use your brain. Do not depend on what people have done. You can develop things. It is not difficult. If you have a will, there is a way. Thank you very much for the patient hearing. Hope I have kept my time. So if you have got any question or query, you can, because time is limited, you can put your queries in the chat box. I shall try to help you. Thank you very much.
Thank
And,
you. Thank you so much.
Definitely, I miss to thank the organizers, IAME, particularly my dear friend, Dr. Pilli Vidyasagar, who was with me for a long time in one institution. Thanks again.
Thank you, sir.
Thank you for wonderful
Madam,
presentation.
thank you, and sorry I could not reach in the for introduction of Tapas Kumar, sir. And
Not at all, sir.
really, it was a miss for me to introduce Dr. Tapas Kumar. Tapas, sir. Yeah, really, he is a good teacher in our medical profession, whom I have seen in the last 25 years. I worked with him for almost 4 years together in a medical college in Calcutta. He is post-MD, 40 years teaching experience, and there's a lot of list of activities with him actually. To tell now, it is not the time. So really, thank you, Tapas sir.
Thank you very
I'm
much.
really sorry I could not give you a total introduction to the
basic
public.
thing is only one, that is love for teaching. You must love your profession.
Yeah.
Then it will come automatically. Thank you
Yes,
very
sir.
much. Oh, please.
Yeah, madam, go ahead.
Yes, yes. Thank you. Thank you once again, sir. Yeah. Can I now request Dr. Sagar sir to please introduce our next speaker, Dr. Swapnil Parlikar sir.
Yes, ma'am. Thank you. Dr. Swapnil Parlikar is a medical educationist, physiologist, and poet. Poet by nature on the medical field only. He writes many poems on us. I don't know whether on a positive way or a negative way, but I heard he's a very good poet on medical people. He did his MD from physiology from Medical College, Baroda, and he's now working as associate professor in the Department of Physiology, Government Medical College, Vadodara, Gujarat. And he has post-PG 19 years of experience, publications to PubMed and Scopus, more than 100. And his, especially the poems are 387 in citations. Am I right, sir? 387 citations?
Yes. No.
Suman,
The
sir?
total.
And as
Sir,
a
386 citations of the articles.
yeah, okay. And mind maps in physiology, a companion guide to Guyton and Hall's textbook of medical physiology, neuroscience, mind maps, and the other side of collection of medical poems. This is about Dr. Swapan. I welcome Dr. Swapan to start this topic. Thank you, sir.
Yes, sir. I'm Dr. Swapnil. Yes, I would request the audience to download the Slido app. Can you hear me clearly?
Sir, I think there's a network issue at your end. Your voice is coming
Okay,
slow.
Yeah, network connections. Let's hope for the best. So I will be talking about critical thinking and the concept of critical thinking and how to implement it in the classroom setting. Request all of you to download the Slido app. I have 4 activities on the Slido. So you can enter this code and type what do you think by the term critical thinking. This
I also didn't check. Not morning now. I just opened the mail now. It came.
I'll give you a minute. Okay, so science, it is a science, it is related to basic and maybe applied and patient, and it is related to care. It is related to analyze and interpret, of course, that will be coming to. And the application, analysis and interpretation, and in-depth thinking. Yes, these are all the qualities of critical thinking which we'll be saying. Yes. Shall I move ahead? 360 degrees analysis, yes, very good. Okay. Reasoning used to direct to solve complex problem, and analyzing is the big thing. Yes, of course. So I'll be talking about the concept of critical thinking and the rationale for it and some strategies to implement it in the classroom setting. So let's begin with the concept, and this presentation is based on the premise of, I have based on the premise of the black cat, campfire, and care. Now, what is this black cat? We know that we have a black cat dilemma. When a black cat crosses our path, what do we think? We think, okay, we are damned. because something very now. So is a black cat crossing our path a boon or a curse? So let's see. Now suppose the boss immediately praises you after a black cat has crossed your path and you think that now it is a boon. So is it still a curse? No, you are thinking that it is a boon and now suddenly you get an ankle sprain when you go out. Is it still a boon? So what is this black cat dilemma? So you begin to wonder, and wonder is the feeling of a philosopher, and philosophy begins with wonder. So what you do is you ask a question, is the black cat really a curse or a boon? You read mythology stories, you read maybe a research paper, somebody has made a qualitative research paper on perceptions of individuals, and then you analyze the whole data, their concept and their interpretations and also their biases. And then you think, what if I persist with this thinking? And finally, you make a decision. And you might land with an accident maybe someday, one because you might get caught up with a black cat crossing your path. So this is what critical thinking is. Critical thinking is that black cat crossing your path signifies that the animal is going somewhere. This is simplicity, but critical thinking is something different. It is deconstructing the whole question. Comes to in the media, whether it comes to the news, whether you have written it, whether you hear or see it, and reveal biases and manipulations, and then come to a conclusion. So it is formulating a question, gathering information. Information literacy is also one of the important 21st century skills, and apply the knowledge and consider other points of view. Be open-minded, be flexible, be ready to consider other points of view. And finally,
Swapnil sir, you're not audible.
Sir, I think he's having some network issues.
So can you ask him to relog in?
Yeah. So in the meantime, if there are any questions in the chat box, we can take it, I guess.
I think there are no questions in the chat box, only wishes that everyone loved the presentation still now. Still, anyone, if anyone wants to ask, we can take a question or two.
Hello,
Yeah, true.
ma'am.
Yes, Leena, madam.
Ma'am, this is Dr. Swapna.
Yes, yes, madam.
Ma'am, I think initially, I think you people have told that you're going to make a WhatsApp group. I don't know whether it was made or not.
Madam, this was regarding?
WhatsApp group for of the members. IAME.
Madam, I think we should restrict this to this talk. The WhatsApp
Yes.
group can be taken up later, please.
Any questions related to our presentations till now?
Sorry, I'm really sorry for this.
I think the presentations were going superb. Yeah, Dr. Swapnil is back.
Just in 2 or 4 words, why do we need to teach critical thinking in the classroom? Okay. So in time judgment, increased thinking capacity, of course, learning on the go as is required in medical education, better understanding and making it interesting helps to make decisions. And that is one of the most important things. And theory to practice, the theory which the medical professional has and convert into practice and use the time of knowledge. Okay, so I'm proceeding. So this is the OECD director said that we are in a constant flux of rapid economic and social change. And these jobs, we have to train students for jobs which have not yet been created and for technologies that have not been invented. And finally, we also don't know the problems which are going to arise. So basically, we need a good citizen and a responsible human being, a Samaritan who helps his fellow citizen when he is injured on the street, and he does his civic duties responsibly. So we need these skills. These are 21st century skills. They are outlined now in the CBSE curriculum, and there are 4 C's. The 4 C's are communication, collaboration, critical thinking, and creativity, as previous speakers have said. Information literacy, literacy about the general knowledge about what media and technology, what media should one assess, and about the technology, how to use the technology. And we need flexibility, leadership, initiative, productivity, and social skills. Flexibility to be cognitively flexible, to be flexible, adaptable to changing situations. Even our departments are in a constant state of flux. Then we need leadership to lead teams, even leading in a classroom, leadership skill. We need to take initiative to implement our vision, implement our goals, and the productivity to enhance, to make best use of time, and finally the social skills to harness all the above skills. So this is what I saw once, and I have taken it. So how have we learned in ancient times? So man went to the continent of Australia 45,000 years ago. And within 15, that is what you all know already says in the Sapiens, that within 15,000 years, all the animals were killed. And how did they do it? They must have communicated with each other, and they must have collaborated with each other. In whatever sign language that was there at that time, they must have communicated, they must have collaborated with each other. And finally, when they sat by the fire in the evening, they analyzed the whole situation. They took information, analyzed the situation, raised a question, gathered information, analyzed, and maintenance was that they lit a whole barbecue of the forest. All the animals were just burnt alive. And this is what the sapiens have literally done over the years, over the ages. So this brings me, Socrates says that education is not the filling of a pail, but the lighting of a fire. And this is what Albert Einstein said. Education is not just the learning of facts, but a training of the mind to think. And that is why we need critical thinking, training of the mind to think rationally, to make these decisions reliably, thinking on the go. That is why we need critical thinking. 21st century education is what there are these learning spaces by David Thornburg, by MIT futurist David Thornburg, and Thornburg talks about these 4 spaces. The campfire, where there was direct instruction was given earlier, and now we have the lecture theater. And there is a collective where a small group discussion is done, where they gather by the well and they make small discussions. Then the person sits in the cave engaging in reflective thinking. Reflective thinking is the term used for critical thinking by John Dewey in 1910. But both he indulges self-directed thinking, self-directed learning, and reflective thinking. And finally, he learns from context or life itself. So some strategies. So what I'm going to focus on active learning strategies on, particularly concept mapping. So as we know, this is the guide on the side approach, being a facilitator, and this is the definition of active learning given by Joel Michaels in his landmark paper, Where's the Evidence? Active Learning Works. And it is attainment, engage in activity that reflects upon an idea and uses it. So we use all the 4 C's in active learning. But this is based on what is known as a constructivist paradigm. That is, the pyramid of Giza was not built in a day. So knowledge is built on previous knowledge. One block by block, brick by brick, based on physiology and anatomy, the pathopharmac medicine knowledge is built, and on that the clinical knowledge is built. So we have these interactive lectures, small group teaching, a flipped classroom, and concept mapping. Interactive lectures, we all know. I've just elucidated some strategies for interact. There is a two-way communication between the teacher and student. Just questioning could foster interactivity. But there is a science behind questioning, which is laid down by Paul Black and Dylan Williams in the landmark paper, Inside the Black Box and Working Inside the Black Box. And it is a must read for questioning in the classroom setting. Then we can have student interacts with the material or content of the lecture. So think, pair, share, or thinking, pair and share, better versions of buzz rooms. Then there is a version of buzz rooms called turn and talk, 1 minute paper, or 3, 2, 1 after watching a video. 1 minute paper where he likes the most the thing which he learned in the lecture, the thing which he finds most interesting, and finally the muddiest point. Similarly, 3, 2, 1 after watching a video, we can give them something to fix, like something, a statement which may be partly wrong, partly right, and they fix the statement. If there is small group teaching, I'm not dwelling into it much, but there are some methods, like even I have converted a small group of 64 students into a very effective small group by using the jigsaw method. And snowballing and nominal group technique can also be used. Then there is the flipped classroom, which I have conducted so many, and that is the lecturing and homework elements of the class are reversed. So student prepares before the class, and in the class, what he does is small group discussion, which is the soul of the flipped classroom. So it is like preparing a chicken. So before the class, there is grating or marinating of the chicken. This may be even through reading through textbooks, which Eric Mazur, the pioneer of the flipped classroom, used since 1991 in Harvard. And then there is the grilling of the chicken, where during the class session, the students apply the knowledge and learn better. And finally, after the class, they come out with product like a mind map, concept map, or some other creative product like Dr. Anuradha has said. And in the pre-class session, we attain the lower levels of the Bloom's taxonomy. Remember and understanding, then we go higher applying and analyzing, and we go to evaluate and create in the post-class session. So this is my paper on acquisition of higher order cognitive skills in the flipped classroom. And with Dr. Chinmay Shah and Dr. Anuradha Joshi, and she was my mentor at PSMC Karamsad, where I received the award for the best poster in ACME. And this is a wonderful paper. You can read it. It is cited in most of the leading essays on flipped classroom, like the flipped classroom over the years in physiology. It is cited among those 80 papers. And this is Dr. Eric Mazur, who started a flipped classroom in 1991 at Harvard. He's a physicist. And he says that learning gains are tripled with the flipped classroom. Well, I thought that I was a very good teacher. And when I started teaching, maybe 1/6 of the class understood. And when I started using the flipped classroom and I used it effectively for two seasons of my renal classes, what happened was that about 70% of the class understood. And that was the 70% which eventually cleared the exam. So I had the opportunity under Dr. Chinmay Shah to conduct about 25-30 flipped classrooms. I had to work out of my skin to conduct them, but I managed somehow. Eventually I plan to go to flipped mastery, but we need the proper assessment methods. And then there is concept mapping. So concept mapping is basically, of course, it is a tool to foster critical thinking. That is why we are talking about it. And what are these concept maps? These are graphical representations. Okay, and graphical representations have been used since the time of Charles Darwin, who drew a tree of life, and by Leonardo da Vinci, who made the Great Lady Anatomy. But these graphical representations are used by learners to demonstrate their understanding. It goes beyond understanding of the relationship of a set of concepts. And finally, there is a hierarchy. This is one of the most important things, hierarchy. There are propositions or linking words and cross links. Now I'll explain you the concept map. See, this is a concept map on peptic ulcer where aggressive and host defense mechanisms are the specific general concepts. Then we go to the specific H. pylori, NSAIDs, and then the host defense mechanisms. And there are cross-linking words. So the words which link successive concepts are known as propositions, and there are cross links. I'm not going into the theory, but what it does, this is the mind map which we had prepared for Alzheimer for this mind map books on guidance. And this is the difference between a mind map and a concept map. This mind map has a single node in the center, while in a concept map there is a hierarchy of concept. And it focuses on one main idea and attains remembering and understanding only. Well, concept map always reaches higher level application, analysis, synthesis, and evaluation. One of the main reasons is that they promote meaningful learning. This is like preparing a chapati. So when you prepare a chapati, you take the flour, which is the base of the learning, and then you add salt and sugar and pepper into it, and then it gets assimilated. It creates new knowledge structures, which leads to meaningfully learned concepts. Meaningful learning is learning based on past learning. That is, there is this base is there, and that if this is built on previous learning through integrated teaching to more of structured correlation based integration, then it may lead to new knowledge being built on previous knowledge. And we also see relationships between ideas. We explicitly seek them in concept maps, and that enhances and leads to better learning, that enhances the critical thinking ability, that enhances the analyzing and evaluating ability. So meaningful learning helps in knowledge construction and clarification of concepts, and that helps in clinical reasoning. Now, how to implement? The main thing is alignment with the curriculum, which we know about constructive alignment. We have been harping it for a long time, and we are doing it also. But to overcome the resistance of the learners is the key. And for that, what we need is simple concepts, simple concept maps to begin with, and then we can use these high directed concept maps, which I have used. You can see this concept map on acid-base balance, role of the kidney, where I have given them the skeleton, and then they filled in the gaps. So I plan to do further study on it, and this is on the same class. Now linking it with patient care. Now we are to what we are really concerned about, linking with patient care, clinical reasoning, and a clinician has more or less this basic science and clinical knowledge which is integrated in his brain, in his cortices, at various parts of the cortices where the memory is stored. And what he does is initial patient information he gains, and then he iteratively gathers new information. But these are two great psychologists, Daniel Kahneman and Amos Tversky, who have written, and Kahneman has written the seminal book, Thinking Fast and Slow. And it's a wonderful book. They founded the School of Behavioral Economics. Kahneman just passed away. Tversky passed away in 1995. Kahneman won the Nobel Prize in 2007 for his work on behavioral economics. And what they said is there is a system one thinking, which is intuition drawn on past experience and based on pattern recognition. So the moment you see a case of malaria with chills with fevers and rigors, and fever with chills and rigors, and coming from a particular locality, you label it as malaria, it might be something else. And system two thinking is slow, analytical, and deliberate. System one thinking is when one sees something on Amazon and presses on it and clicks and buys it. That is system one. But if one analyzes it and does deliberate thinking, that is system two thinking. So this is a real example actually which occurred in my family. And the person was diagnosed with COVID. There was a small X-ray chest, X-ray nodule in the chest, and patient didn't pass her. I just put it, but she was labeled as hemodialysis had occurred. But if the clinician would have paused, questioned, gathered information through a CT scan, come to the conclusion, and then the patient would have been rightly treated much earlier. The person is still being treated. So now I have one more slide. There's a quiz, I think. Yes. Which of the following is not critical thinking? You just have to click. What is 1 minute for this?
Sir, try to complete fast, sir. We are running out of time.
Sir, 2 minutes only.
Yeah.
It is over now. Okay. So this is the answer. I think we'll proceed. Another. Following is an example of meaningful learning. Just click. What is an example of meaningful learning? Okay. Half a minute left. Okay, let's. Okay, so great. My job is done. 85% have answered correctly. So what we are doing is making reliable decisions based on reliable information. To conclude, critical thinking is one of the essential 21st century skills, and it involves a process of deconstructing the situation, addresses manipulations and biases, and then arriving at a decision. And active learning strategies like concept mapping can foster critical thinking, and that will reduce errors in medicine and improve the quality of care. Thank you, and a copious thanks for inviting me. Thank you so much.
Thank you, sir. Thank you so much for giving us a very enlightening lecture. And I hope you'll be ready with some poem on the doctors after the Trupti session. 2-3 lines of a poem on the doctors after the session of the Trupti, Dr. Trupti. Okay, thank you, sir. Now coming to the final speaker, Dr. Trupti Borulkar, MBBS, DCH, MD, PG, DPC, PG, DML, PG, a lot of things are there. And she is having over 25 years of experience as a pediatrician and child adolescent counselor. And many things are there. I don't want to much. But one thing I can tell, she is the most dynamic lady of our group. And she's the inspiration for me. And she's a guiding force for me for this program. Thank you, ma'am. I may not be able to thank you after that. That's why I'm thanking you right now itself. So, madam, please kindly take over the session. Thank you.
Dr. Vijay Kumar, I am not able to start video. I don't know why. Okay, maybe video settings. Still, I am not. Save assistant. Is there any change settings? Thank you, Dr. Sagar sir, for kind introduction. And I will make my presentation little crisp because of time shortage. But I don't know. Video, USB video device, select a camera or some message is coming. Video setting.
No issues, ma'am. We can go without the video itself.
Yeah,
We can start.
I don't know what is happening. Okay. So, unlocking student potential, the power of PAL, that is modern and effective learning, peer-assisted learning. So, I'm getting that message again and again.
Sorry to interrupt.
Madam, go to the next slide.
Yeah. Yes, sir. So can you manage, because it is getting difficult for me.
Yeah, madam,
Sure.
you just play.
Sure,
Yeah, I will just speak. So,
Yeah.
what is the peer-assisted learning? It is a vital strategy for enhancing the learning experiences, and ultimately, we make the future medical professional competent. So, what are the demands of medical education and why we require such innovative learning teaching strategies? So, the first is high volume of complex information. There is a deep understanding need and long-term retention. So no semester-based syllabus, one semester you can study and then forget it. It's not that like. So the student has to retain the information, the understanding, the skills, whichever he or she has acquired throughout life. And development of critical clinical skills is very important. Along with that, professional and interprofessional or interpersonal skills are very much required in today's era. So the role of innovative pedagogical approaches is come into picture because of the demand of this dynamic medical education system. So what do you mean by peer? Next slide, please. So peer-assisted learning, it is a collaborative learning approach where students teach and learn from each other. It enhances knowledge retention, critical thinking, and teamwork. It goes beyond informal study groups. Informal groups, it is not like that. So it is a well-structured formal group which the activities are very much well planned. So in Socratic inner learning circles, then Gurukul system, there was hand-holding by the senior students for the junior students. But it is little different from that. It is a structured, well-organized, well-planned activity. Next slide, please. So how PAL works in medical educations? It's a peer tutoring, senior to junior. So I remember PG clinics in the absence of social media and all that, the agendas were different for senior students and junior students. But still, we still remember what our seniors has told. In my PG exam, I remember in second year, I attended one PG clinic in the evening, and that Rasmussen's aneurysm, my senior taught in case of a hemoptysis in tuberculosis case, it reflected, I remembered that in my PG exam, and I got appreciation from external examiner. So it was like that. So peer-led small group case discussions, which will be like senior students teaching clinical cases, encouraging critical thinking, differential diagnosis, and management planning. Then peer-led simulation debriefings, feedback. So it is like providing constructive feedback after the simulated patient encounters. Collaborative learning on clinical skills, peer review or presentation and written work. Maybe it is a poster, maybe it is a research proposal, maybe it is a poster or model making, anything. So any constructive remark, in any constructive feedback, any sharing of thoughts in the peer group will be like a PAL activity. Near peer mentoring, it can be not only in the academics, but it can be in the time management, it can be emotional well-being, it can be any other thing along with the academic helping or academic mentoring. So why PAL is powerful in medical education? It reinforces foundational knowledge and bridges the theory to practice gap. So teaching is the best way to learn. When one student teaches the other students, he or she himself will learn. That is the main thing. Relatable explanations, peer often explain concepts in their language and context. So they resonate more readily with the fellow students. So the gaps are bridged between theory and clinical relevance. Active recall, like just said, I recall that incidents or that information at my PG exam. So active recall will be there and application to the clinical scenarios. Developing essential clinical and professional skills, enhanced communication, interpersonal skills, which are must in today's era, increase confidence in clinical skills, low stake practice, where the grading is not important, but students should know that the skills. These skills are often taught by seniors and they are practiced off college hours, fostering collaboration and teamwork, which is really must in today's world. So overall, in professional and interprofessional or interdisciplinary skills are developed in the PAL activities. My PAL is powerful in medical education because it addresses emotional and psychological aspects. It reduces stress and anxiety because the same age, same group is there. Then building a sense of community and support networking, which will carry forward throughout their life, and they will handhold, they will be a friend for a longer life or longer duration, even professionally and personal life. Normalizing challenges and encouraging help seeking. Sometimes students may feel awkward to reach to the teacher or faculty. So the challenges, and if they need help, they will take help seeking from their peers or their same age groups. Then this promotes the empathy and understanding of some trivial issues also. So it again helps faculty. So how? So identifying students need which students need additional support. So when there is a structured PAL activity, so teacher can notice the students who are in leadership role, who are little non-active. So accordingly, teacher can help those students and make the best out of them. So potential free up time a faculty can get. So he or she can utilize in research activities, in any other creative thing. Cultivating a culture of peer support that gives immense satisfaction, that gives immense health or mental well-being in this today's unrest era. It supports competency based medical education. So for faculty, these are the powerful things for using PAL. So next slide, please. Dr. Vijay sir. Yeah. So benefits for all learners in PAL, tutors and helpers, they will get deep understanding through the explanation. So the concept will be very much clear. Then development of leadership and teaching skills will be there. Reinforcement of their own learning. While teaching the other students, they will learn more. Tutees or those who seek help, the personalized support in less intimidating environment. When they feel good, the outcome will be naturally the good or the best. New perspective and approaches will come because of discussion, and they will be free. Even if they are monitored by teachers, there will be facilitator, there will be silent teacher, shadow teacher, like that. But it will be, they will be very open, and then the new perspectives to the same thing will be open up. Increase confidence, it's again. So for all participants, increased or improved communication, collaboration skills, enhanced critical thinking abilities, and more engaging supportive learning environment, which is must, because today's students, that Gen Z, are very much into many things, and their attention span is less. They are doing so many things at same time, and the social media again is a problem. If we say it is a problem, if we convert it into a good tool, it is again a good thing. So but still the Gen Z students are a little over occupied as compared to us, as compared to teachers. Next slide, please. So implementing PAL effectively in medical education, faculty buy-in and support is required. So successful integration will happen when the faculty have faith in this. They will plan activities, they will do structured activities, then only it can go forward. Clear learning objective and structured plan should be there. Focus learning activities should be there. Training for peer tutors and facilitators. Equip them with necessary skills. Not anyone can do a peer tutoring. There are some qualities you have to check out, that you have to observe that, and you have to train, you have to make these students as a tutor. Then careful matching of tutors and tutees. Consider various factors for optimal pairing, like socio-cultural background, cultural competencies, the cognitive level, the learning style, and many other things we have to take into consideration, and then we have to go for PAL activities. Next slide, please. So integration with curriculum is must. Align PAL activities with learning outcomes. All of a sudden, you can't do anything. You have to plan in advance. You have to give a brainstorming in your department. You have to take your colleague's opinion, and then you have to move forward. With resource and space should be. So whether it is in a lecture, whether it is in a seminar hall, even in practical lab, even in bedside clinics, even in simulation lab, whatever place is there, you have to take out adequate resources. You have to chalk out the plan and then implement. Monitoring and evaluation is must for the effectiveness of PAL programs. Recognize and incentive, give incentives for the students who are participating into the PAL. So that will flourish the activity, that will flourish your motto, and it becomes your education institute's culture. So implementing PAL in various environments, classrooms, study rooms, and peer discussion. It can go online, virtual buddies, you can collaborative tools, you can use hybrid modes combining digital and in-personal learnings. Next slide, please. Integration with modern techniques, simulation-based learning, virtual patient scenarios. You can form group and they can discuss, and then they can give feedback on debriefing and in the debriefing sessions. Case-based learning, peer discussion on clinical cases. Maybe same batch students or interns can help them in the case-based learning when the faculty is involved into any other thing, but one faculty can monitor all such things. E-learning and blended learning online platform for collaborative study is there, and these new students are very much acquainted with this. Flipped classroom, Dr. Swapnil sir has mentioned it in detail. So these learning materials reviewed before discussion, and then students come, we can take quizzes, we can take some other activities, and that the concept or that topic is reinforced in different ways. Innovative and creative PAL approaches, reciprocal teaching, role swapping. It can be done in the didactic lecture also, as a part of that, as a part of tutorial seminar. Gamification, quiz battles, or anything you can do. Narratives you can do. Teach back method, like when you teach one topic into the lecture, you can ask some students to teach back again, teach that same concept. So again, it will be a twice learning and it will be good. What are the challenges and solution? Unequal participation may be there, so it should be structured. You have to assign each and every role to respective student. There will be sometimes knowledge gaps, so you have to do mentorship, you have to plan, you have to tell the who are the tutors, you have to tell them these are the things you have to discuss with students. So you have to mentor the tutors properly. Lack of engagement will be there, so you have to use interactive methods like different tools, different online tools, or different activities, or anything you can do, like narratives, role plays, anything you can do. If there is a resistance to PAL, maybe from faculty side, maybe from students end, you have to foster a supportive environment. Once they will see the results, they will be more into the PAL activities. Next slide, please. So moving forward, how we can do PAL activities? We have to think PAL as a valuable adjunct to traditional teaching methods, potential to significantly enhance the learning journey. It will cultivate competent, compassionate, and collaborative future physician. This is a time to call, to take action, to explore and integrate PAL initiatives within the curriculum. Next slide, please. So, in summary, peer assisted learning is an effective and modern approach in medical education. It fosters deeper understanding of all concepts, all clinical skills. Professional development will be more, collaborative learning will be more, and this PAL will make a crucial tool for training future healthcare professionals in India, where sometimes faculty shortage is there when we decide to develop or to deliver a good teaching learning method. So if we use such activities, it will help us as faculty. So structured PAL transforms medical education. So that's the message. Thank you. Even if I am an in-house member, thank you our team, and thank you all for patient listening.
Thank you for that wonderful presentation, madam. We are
Thank you,
running.
madam.
Dr.
One
Sagar,
small
sir?
submission. Dr. Swapan is ready with some small poem on doctors, on
Okay.
medical. Dr. Swapan
Yes,
sir, please
Very
take part.
good, very
yes,
good.
yes. The poem is titled If a Teacher, and this poem I have written inspired by Dr. Hemant Mehta, who was the senior most physiologist in Gujarat, and he was a very nice person when he retired as dean. So I have written, if a teacher teaches with passion, and is true to his profession, if he uses the latest pedagogy and clears concepts that are foggy, if he engages in scientific inquiry and even publishes it truly, if he holds you up when everything around you is bust, if he mentors you honestly such that you make it finally, if he is upright when circumstances don't seem right, if he abides by these traits, if he is a man of faith, then he is truly a teacher who will touch your future.
Thank you, sir. Wonderful, wonderful.
That
Thank
was
you,
really
sir.
good, sir. Thank you so much. Dr. Sagar, sir, can we take a question or two?
Sure, ma'am.
Yeah, yeah. So I think this one question was for Dr. Anuradha Joshi, madam. Madam, are there any resources to show videos in classroom?
Yeah, there are resources like abhi jo CBME mein, like I remember, there are on the mortality, morbidity, Indian context mein, काफी सारे videos हैं. There are. If you want, I will share the link with you. We have lot of videos. Yes. But we need to see कि video is specific for what objective. What are you basically trying to show and why? So we need to know the why for our videos. That is very, very important.
Right.
Hello, am I audible?
Yes, yes, yes. You
Like in the first year students, when we were showing the Gifted Hands movie. So actually we all as educators believe in scaffolding process. So when in the first year student is coming, they have already attended the foundation course, they are already galvanized in their new journey. Ki bhai hame doctor banna hai, we have to become physician, surgeon. That's why I chose to show this Gifted Hands movie to the students of the first year. So we need to know why, which audience, what time. It's all there is a lot of confounders, lot of factors come into play to show a video. Lot of thinking goes. Like me and my team of cinema education, we watch the movie 3 times before we are screening in front of the students. And the planning, like now in the June, the third movie which has to be shown, the planning has already started from now. So videos तो बहुत सारे हैं, but the thing is कि आपको क्या topic है आपका, what you want to show, what is your objective, it has to align with that. Clips also have to align. If we want to show empathy, there has to be clip. There is a movie by the name of Wit, wherein a professor suffers with the carcinoma. There uska ek clip leke we have to show that empathy. So that that alignment is very important. And that's why I say that creativity is an entire process. It's not entertainment. There's a flavor of art and entertainment, but the maximum part is the process of learning objective and outcome achieve ho raha hai ya nahi.
Very well said, madam. Very well said. I think one more question. This is for Dr. Swapnil, sir. How to add a Marvel element in vertical integration, especially between anatomy, physiology, and surgical branches? Sir, please unmute yourself, Dr. Swapnil.
Yes, madam, Marvel element.
This was the question.
Yes. We can. I mean, I have not integrated anatomy, physiology, and medicine, but physiology and medicine, of course, we can do at any time. And you can make concept maps. There is a tool called CMAP tools, and it is a totally free tool on iPad. It costs 400 for lifetime, and you type your question, and based on the keywords, you choose the general concepts, then the specific concepts, and then you make the concept map.
Okay, thank you, sir. There was one more question. How did you offer the pre-class information to the first year students when one major concern is always that students never learn what is given and come to class?
that it is a very, very big challenge in our setting. We have to, I prepared my own, but students never came reading those videos, but there were 8 videos only. Maybe 8 minutes twice in the class. I gave them to watch the video. That was the only thing I could do. Even a government college, I couldn't ask them to leave the class by after taking an ERAT. Yeah, that is individual readiness assurance test, because that is not feasible. And all these things, that is a big problem, big challenge in our city.
Okay, yes. Thank you, sir. One last question. I would like to ask Dr. Tapas, sir. Sir, are there any, what are the type of rewards we can give to students? This was one question that arises.
So encouragement can be done in many ways to the students, but students don't opt for so many costly things or any of that. What we used to do, just give a certificate of appreciation or a small gift like a small token as a chocolate or anything. That will be a motivation. Apart from that, what I say usually that if you do something innovative, that will be there, your names, etc. will be there. And when you come with your grandson or granddaughter in the reunion after long years, you feel amazed that this time I have done this thing. So reward is not very much expensive, neither it is provoking, but simple, just telling them that you are great is a reward. So I think it is not a problem to anybody to make it rewarded.
Yes, sir. Yes, sir. Truly said. Thank you so much. As we are running short of time, I would invite Dr. Sagar, sir, to summarize our whole program. Over to you, Dr. Sagar, sir.
Yeah, thank you very much, ma'am. This was a really wonderful session. Never heard of these type of topics till now. This is the first time I also listening to these type of topics, and we also need to change a lot with these things. And I think our IAME should promote more and more sessions on these topics so that more people are benefited out of this. Thank you, ma'am.
I now invite our National Joint Secretary, Dr. Hitesh Mishra, sir, to propose the vote of thanks.
Okay, thank you, ma'am. Am I audible?
Yes, yes, you are.
Okay, so thanks to IAME for giving me the opportunity for a vote of thanks there. And first of all, I would like to thank all our speakers there, Dr. Anuradha Joshi, madam, Dr. Tapas Kumar Bose, sir, Dr. Swapnil Parlikar, Dr. Trupti Borulkar for doing justice with their talks there. I think this was really very innovative type of talks there and lucid and elaborative talks there. I also extend my gratitude to the organizing secretary, Dr. P. Vidyasagar sir and his team for organizing successfully this symposium there. I would like also thank to all the online participants. I think the 100, I was what measuring it was up to the 100 online participants were there at one time there. And my gratitude to our national president, Dr. Pragnesh Parmar sir, and treasurer, Dr. Vijay Karthikeyan, for their continuous and enthusiastic support all of the time there. And last but not the least, I would like to thank our technical team for providing the uninterrupted technical support and to all the members behind the curtain there. So thank you once again, all of you.
Thank you very much, Hitesh.
Thank you, sir. Thank you.
It's an excellent show.
Thank you, Hitesh, sir. Thank you so much.
Welcome, ma'am.
So we call it a day. Thank you, everyone. Thank you for the wonderful participation. Thank you so much.
Thank you so much,
everyone
ma'am.
for joining. Thank you very much.